Good evening and welcome to the Royal College of Surgeons of England webinar series. I'm Nuha Yassin, I'm a colorectal surgeon in Birmingham and I'm a robotic surgeon. I'm delighted to be joined today by my colleagues Ryan Kirstein, who's a plastic surgeon from Buckinghamshire, and he's also the lead for the Innovation Hub at the Royal College, and also Nadine Hashash Haram, who's also a plastic surgeon and innovation lead. As you can tell from all the titles, that our topic today will be focusing on innovation at the Royal College of Surgeons of England as part of the overarching umbrella of the Future of Surgery initiative. So thank you so much. We're also joined by Jane Roberts, who is the events lead, and she'll tell you about all the exciting upcoming events towards the end of this webinar. You'll hear an introduction initially about the Future of Surgery program, and then I'll leave you to listen to the pearls of wisdom of Nadine and Ryan, and we'll follow up with questions from the audience. So thank you for joining us. So you can see the first slide. Second slide, please. So this is our panel for today, as we've already discussed. I'm Nuha Yassin, we're joined by Ryan and Nadine. Next slide, please. So the current structure of the Future of Surgery program, Richard Kerr has been the council lead for the Future of Surgery program and has been part of council for 10 years. He's sadly going to be demitting in July, which are massive shoes to fill for me to be the Future of Surgery council lead after Richard. He will remain a mentor and greatly involved. I'm currently the robotic lead at the Royal College. We also have Ralph Tomlinson, who is the staff lead from the robotics point of view, and he's also director of quality and research. As part of the robotics group, we also have Simon Bach and Naeem Sumru. Simon is the surgical lead for research at the Royal College Robotics Program, and Naeem is the surgical accreditation lead at the Royal College. Ryan, of course, you've just met, is the Innovation Hub lead at the Royal College. So this is our current structure. Next slide, please. So we'd really like to thank Richard Kerr, who's a consultant neurosurgeon. He's been doing a phenomenal job, but most importantly, relevant to today's webinar is commissioning the Future of Surgery report. Next slide, please. So this was back in 2018, and it was commissioned as part of the 70th anniversary for the NHS. It was an independent commission sponsored by Royal College of Surgeons of England, and we wanted to know the future of surgery in the UK. It was set up in October 2017, and you can see Ryan and Nadine were part of it at that point and are still part of it today. Essentially, 14 experts were tasked by identifying the advances in medicine and technology for the next 20 years, and there have been 70 written contributions. So it was a mammoth task, and the report is really worthy of reading. So I do hope you'll all log on to the Royal College website and read the full report later on. Next slide, please. There are 4 key areas that the report focused on. And essentially, it's minimally invasive surgery, not just how to do it, but training and everything else that surrounds the area of minimally invasive surgery. That includes laparoscopic as well as robotic surgery. The second large area was imaging and virtual reality and augmented reality. A key area is also big data. So we're not just talking about HES data, we're talking about any large data that involves innovation and minimally invasive surgery, and of course artificial intelligence, which is all interlinked. And finally, specialized interventions. In our next webinar, we will be going into details for each one of these 4 areas. However, today our focus will be on the innovation part. Next slide, please. So once you read the full report, you'll know that all that work came to a sudden halt. You'll all know why. So next slide, please. Unfortunately, we had to have Zoom meetings and GoToMeetings. So there are perks to COVID. However, it did put a little pause on the general Future of Surgery program. Next slide, please. Next slide, please. And generally, I think we've learned a lot. The Future of Surgery report has commented on the need for surgical workforce and the various elements of the Future of Surgery report into integrating how we can do that in the here and now, as well as the future. Next slide, please. So what's next for the Royal College? So we've given you a brief synopsis on the future of surgery and the four big areas where we've been working on the report. And for our next section, next slide, please. We aim to change the face of surgery. So we have a strategy for the next 5 years. Next slide, please. And by having strategic aims, changing the face of surgery is in its literal and metaphorical elements. So we are focusing on how we lead our profession at the Royal College of Surgeons of England, how we improve overall practice, and how we involve our patients in what we do on a day-to-day basis, how we engage with all of our members, including how we train our future generations. Embracing diversity means encouraging those with talent, regardless of their background, to be able to contribute effectively and be welcome to the table. And of course, transforming the college as a whole and make it into a welcoming and homely environment. Next slide, please. And these strategic aims are also part of this Future of Surgery aim. So we aim to have an extensive program with regards to technology and robotics in surgery and all the other four elements that we mentioned earlier. Next slide, please. We started by launching the robotic program in a webinar around the COVID time in September 2020, and we've had a gap, and now we're back with our first webinar again in 2023 and a few other webinars coming up soon. Next slide, please. We've had some publications from a research point of view with regards to robotics and future of surgery, and you can see this one here in BJS Open about measurement of outcomes and safety and effectiveness of robotic assisted surgery. And it's important to highlight both safety as well as effectiveness. Next slide, please. And the next slide, please. And we have two other research programs. Next slide, please. Next slide, please. And that's the mastery program and the reinforce one. And we'd like to really thank all of our collaborators, but two key members of the team are David Beard and Marion Campbell, who are still part of this research. So mastery is measuring the quality of surgical care and setting benchmarks with regards to robotic surgery. And the reinforce program, both are NIHR studies. They're both supported by NIHR and have gained 1.3 million or more support in that sense. And the reinforced one is a real world in situ evaluation of the introduction of robotic surgery. So we await the results eagerly. Next slide, please. There are other areas in research that we're contributing to in the robotic field, and that's looking at the development of surgical robotic programs from a research as well as training perspective. Next slide, please. And we have wider participation and partnerships, including accreditation as well. It's really important to accredit the training centres across the UK to ensure the delivery of high standard training for minimally invasive surgery and robotic surgery. Next slide, please. And quality assurance and in colorectal fellowships. Well, colorectal being biased, I'm colorectal, of course, I mean clinical fellowships and robotic training as a whole. Next slide, please. And I'd like to highlight that actually the RCS England have now an e-learning module with as part of the Future of Surgery programs. The example here is robotics, but actually when you go online, you'll see that there are various other aspects of how to engage in innovation and complete these e-learning modules, which is a great start of how to become part of this Future of Surgery program. So please do find the links online and enroll onto these modules. Next slide, please. We are enabling trainees to lead. The future of surgery relies on training today's trainees, and we have funding in order to facilitate this. We've collaborated previously with ASIT, with part of the Future of Surgery report, and developed a second report about technology enhanced training. Next slide, please. And you can read both reports online. Next slide, please. I won't dwell on this because we will have our next webinar specifically targeting all aspects of training, but these are the essential 4 or 5 elements that are highlighted in the report of how technology can support training and how it can be implemented and embedded, and of course the stakeholders that need to be involved, such as HEE and JCST. Next slide, please. Of course, we have publications about good practice guidelines. We already have the Surgical Innovation Technologies guidelines, and we have the Good Surgical Practice guidelines. We're currently working on robotic practice guidelines as well, so watch this space. Next slide, please. So in general, our vision as part of the Future of Surgery program is to facilitate research, improve training, use data optimally, and raise awareness as well as involve patients. Next slide, please. So this is Ralph, an embarrassing photo of Ralph. I thought I would get people to email you, and you're more welcome to email me with regards to any questions with the Future of Surgery in mind. But more importantly, let's start today's webinar by focusing on innovation. Our first speaker is Nadine Hashash Haram. The floor is all yours. Thank you for being with us today.
Thank you so much for having me. It's a pleasure to be here. A pleasure to be amongst friends, and Ryan, it's always a joy to sort of share the panel with you, and Naha, it's been a delight getting to know you, so really great to be here. And I know I have some slides that they're going to bring up in a second, but what I thought I would do is focus a bit on innovation and entrepreneurship, and share a personal perspective, because as someone who has been through it before, I can sort of walk you through what it's like to build a portfolio career around innovation. And some of the elements around that. We can see the text as well, so I don't know if you want to bring it into full slide mode. I know we struggled with that earlier. Put it in slideshow mode, yeah. Excellent. So while she's trying to work that out, I have to say I've not used GoToWebinar in many years, so we're all trying to sort of learn how to use this new one. But to give you a bit of my background, so I'm a consultant plastic surgeon at Guy's and St. Thomas's, and I have an interesting role there, and I wear a few hats. One, I am a clinical innovation lead and head of industry strategic partnerships. So I do 50% of my time is clinical, the other 50% is dedicated to innovation. And that was really a role that was brought on by the chief exec of the hospital, who really believed in clinically led innovation and encouraging clinicians to sort of drive the path forward. And so what I decided to focus on was supporting industry partnerships, that private-public partnership piece, which of course, the Office of Life Science and Life Science Strategy really talked about. But also I was able to set up the first NHS venture fund. So it's the only NHS-backed venture fund that exists today, called KHP Ventures, and I co-manage it with a colleague of mine, Daniel. And so I was able to sort of craft a very interesting career where I'm really bringing that healthcare, academia, innovation, and private capital to sort of to the fore and to the front line. I'm also an entrepreneur myself. I'm the founder and CEO of Proximie, and I'll touch on it a bit today as well, more to sort of lean into how this sort of builds on the Future of Surgery Commission. As we try to figure out the slides, I think I'll just kick off and start talking, if it's all right with you, Naha, and then they can sort of catch up with the slides as they get to where they need to be. A bit of my background as well is...
Sorry.
I'll just keep talking, it's okay. So just the other bit to say is, why I kind of decided to take on such a career and such a portfolio approach probably stems from my background in childhood as well. So I didn't grow up here, actually. I grew up initially born in America, in California, but at the age of 9 or 10, my parents decided it'd be a very good idea to move into sort of post-war Lebanon as a good way to connect to our culture and our community, but also see life from a different perspective. And probably back then as a 9-year-old, I'm thinking, why? You know, it's sunny California, why should I move into post-war Lebanon? But now, many years on, I think it was probably one of the best things they did. because I was able to grow up in an environment where you see the fragility of life, you see the importance of community and giving back. Also, the fact that not everything is available sort of on a platter. You have to really work hard and try to figure out how to get access to healthcare, to medications, to all the simple things that we have taken for granted, that at least I had as a child. And I think it really taught me the most about resilience, you know, how to build through. And I think resilience is something you need when you take on a surgical career, and it's something you need when you're really trying to disrupt and change and innovate in a system that's incredibly complex, which is healthcare. And so that, for me, really prompted me to really think about my role in the world, and as, you know, one person, of course, with humility, what role could I play to make the world a better place? And so, having seen war, I realized that I wanted to commit myself to reconstructive surgery. I'd seen trauma, blast, you know, those kinds of things, and I thought, you know, the best thing I could do is really help improve the quality of life of people. I know there's many surgical specialties that are life-saving. I think often, on the whole, plastic surgery is more life-changing as a specialty, but it's something that's hugely impactful for people's lives. So I went on that journey to be a reconstructive surgeon and dedicated 10 years to global health, and would travel many weeks a year to different parts of the world to look at how we build capacity and sustainability in surgical care. But after 10 years, as we all do, you know, when you take a step back and reflect on what you've achieved and what you've done, I also started to reflect on what I was achieving and what impact was I as an individual surgeon making in the world. And unfortunately, it was around the same time that the Lancet Commission published that 5 billion people around the world lacked access to safe surgery. And that for me was a real punch in the gut. You know, I was out there in the field, working with missions, traveling to different parts of the world, some safe, some less safe. And to see that huge number, compounded by the fact that 18 million people every year die as a lack of access to that surgery, that 310 million patient procedures are happening every year, and yet we needed an extra 143 million procedures. We're on slide 6, by the way, if it's helpful. That was really just a huge supply-demand gap, that it almost didn't matter how many missions or trips I went on or many others, that we just couldn't bridge that gap. And so it became clear to me that there was a compelling need to think differently, to think innovatively, and to think about the environment that we operate in. And many of us have been in operating rooms, and we look around the OR, and I'm sure we acknowledge how analog it is, how disconnected and siloed it is. And there's some great devices in there, great machines, but they're all quite disconnected. Everything we do just happens in that moment in time. And as we move on to slide 8, it was clear that we needed more surgery and more surgeons. And so the typical model of training, taking 10 years to train a surgeon, was just never going to cut it. Even this morning, I was on a panel at London Tech Week, and everyone was talking about, you know, the challenge of the workforce. And I just said, the challenge is a huge challenge because of the way we deliver the work and support the workforce. But if we took a step back and completely redesigned our health system, you know, how big of a problem would that still be? How do we think differently? And so if we move on to the next slide, you'll gauge from that I am an Arsenal fan. Yes, I am a dedicated Arsenal fan. But for me, and Ryan's shaking his head, and I love what he said. You know, the biggest things. Okay, good. The biggest things in life have been achieved by people who start and who be judged crazy. And I can tell you, as someone who has innovated and disrupted, there are countless times in the early years. I'm talking 2013, 2014, when I started innovating, where people told me I was crazy, laughed at me, laughed me off the stage. But I'm pleased to say, you know, that 8 years later, when I look back, every one of those moments was a sort of strength building moment for me as an innovator, and the resilience to keep going. And it really started with a desire to make a difference and a desire to think about how we define the future of surgery. And if we move to the next slide, I was incredibly fortunate to be invited by Richard, who's a dear friend and mentor, to come and join them on the Future of Surgery Commission, to really think about how we redefine the future of surgery. And this was, I believe it was about 2016, 2017 when we started writing this. Of course, it got published in 2018. It took a while, but you know, back then we were sitting there and thinking, you know, what are those groundbreaking technologies that are going to change surgery? What is surgery going to look like 5, 10, and 15 years from now? And as we move to the next slide, you know, there was some key thematics that, you know, Nuha touched on. But from a technological stack sort of thematics, there was things around real-time connectivity, AI, machine learning, augmented reality. We also talked about big data. We talked about VR. We talked about genomics and precision medicine. And it was an incredible, I was just so inspired by that roundtable. We had patient representation, we had surgeons, we had trainees, we had the college, all sitting around the table, really thinking about, what is the future of surgery going to look like? But as we move to the next slide, what was also really critical in that message, and I hope that's what's come out of it, and I believe it is that healthcare is still human. That whilst these technologies and these solutions are important, they are not here to replace the human touch. They're not here to change what we do. They're here to free up capacity so we can do things more effectively, more efficiently, more standardized through more patient safety, more clarity, and removing that opacity, but making sure that it also frees us up to do the things that we're meant to do. Spend time with patients, human touch, empathy, working with them. Of course, ChatGPT does seem to be empathetic as well, but we'll park that to one side. And as I started to look at, as I was innovating and thinking about the digitization of the operating room and how we changed the OR, what was also clear to me as we move to the next slide, that video and components around video architecture and cloud, we can just keep moving on, were critically important. And so as we started to think about, how are we looking at the role of video? Why is the OR so opaque? What is the data transformation that we need to take in the operating room? We'd moved into sort of video operating, if you think about it, when you look at laparoscopic, minimally invasive, robotic, all the OPEX surgeries, it's incredible. But we weren't really capturing that video stack, making every one of those devices cloud or edge enabled, to think about how do we really truly connect all the operating rooms around. And of course, that's what the future of surgery talked about as well, a connected, data-driven, transparent operating room. And moving on to the next slide, it was really about taking it all the way from training to the forefront of care delivery. So how do we move from a see one, do one, teach one sort of methodology to a digitized methodology, a prepare, perform, perfect, where different tools that were all referenced in the report could play a role in this. In preparation, whether it's VR, simulation, video-based learning, virtual, in real-time collaboration, to performance with support and mentorship and coaching, to perfection. How do we go and look at analytics and AI to really analyze and benchmark us in a much more standardized way? And that kind of leads us on to my personal journey, where I moved into looking at next slide, how do I create the cloud infrastructure, the cloud system that enables us to deliver a truly digital OR that is not only about applications that I'm building, but ones where we can start to really aggregate and bring key applications in surgery together in one environment, so that surgical teams are not having to log into 7 different systems, but we're bringing everything together to enable cases to be securely recorded, analyzed, shared, to turn these operating rooms into real-time learning environments, and hopefully improve safety and efficiency, which I think is the most important thing moving on. And I would encourage everyone, and no matter what technology you're looking at, and again, next slide, is to really think about the quadruple aim, whatever that technology is. And it's something I looked at in my experience as well. How do we support training? How do we improve patient experience? How do we improve system efficiencies? I think, probably one of the top 5 priorities of government today is productivity and backlog. Like, how do we work towards that? And how do we improve patient safety? I think it would be naive of me not to sort of call it out, that we know we have a high issue around variation in surgical care. We know that, it's in the GIRFT reports, it's public data, we need to do something about it. And moving to the next slide, by digitization, by transparency, by moving this sort of cloud infrastructure to enable us to share this knowledge, that's how we move the needle forward. You only need to look at, the work Peter Brennan's doing on human factors, what Martin Elliott talks about in terms of, that kind of work, that sort of standardization and codification. And as we move to the next slide, we've also been able to show that by engaging these solutions, we can train twice as many surgeons in half the time whilst maintaining the same quality. And I think that's critical when we think about where we need to move to bridge the gap of need versus availability of clinicians and workforce. And moving on, leaning again into the Future of Surgery Commission, we talked a lot about the role of big data. Everyone always says, oh, the NHS is great, it's got a ton of data. Yes, it does have a ton of data, but it's all siloed. And it's really hard to access and it's really hard to analyze. and yet we are sitting on the biggest sort of data set in the world. But we haven't built the biggest surgical data set. And I think by leaning into cloud compute, edge compute, solutions that help you aggregate the data, we're able to sort of really lean into the safety database revolution. As we move on to the next slide, we know that safety has already been undergoing a database revolution in other industries, in the airline industry and others, and it needs to happen in surgery. Moving on to the next slide, we know that data is fragmented. Yes, we have lots of pockets of great data, but it's still fragmented, and we need to sort of join this all up to learn from it. We need the data to speak a common language, and I think these innovations and what I've been trying to do at Proximie are enabling us to do that finally. We're enabling us, as we move to the next slide, support recording in the OR, support standardization, and support the delivery of that digitized analytics back to you. And oftentimes there's a sort of myth that it's patients that are nervous about it and it's patients that don't want us to do it. Actually, we surveyed 5,000 patients and specifically then asked 1,500 about would they support recording in the OR. And these were patients that had had surgery in the last 5 years. And a large proportion said yes, they would be comfortable with surgery in the OR. And so much so that almost half of them said they'd be willing to pay for it themselves if it was not available on the NHS. So they expect organizations to be putting safety at the heart of it. This is a posture towards safety. I think we should no longer shy away from it. It's this transparency, this data-driven environment that I think will make us more accountable and show that we're willing to share our data and learn from it and become better. Just quickly to move on to highlight where sort of what I've been able to achieve through my journey. Next slide is through this development of Proximie and the platform, we've gone into 800 facilities worldwide, collating thousands of cases. And I only share this not for applause or sort of to pat myself on the back, but just to say is, with grit and sort of, a desire to move this forward, you can kind of hit that number and that critical mass. And there's so much more, I think, that can be done. Moving on again to sort of the role of technology, and I want to keep bringing it back to the Future of Surgery Commission because that underpins really why, why I think I felt more empowered and encouraged to innovate. I have to admit, when I started in 2013 and 14, I was kind of doing it behind closed doors. I was sort of working and trying to sort of innovate, but also conscious that there might not be well accepted amongst my peers. It felt quite lonely. Until, of course, I met Ryan, and we're the lonely two trying to sort of do this as we work through, and then many others. But the Future of Surgery Commission, as it came out, gave me a sort of a revitalization that I can be more bold and more open about what I'm working on. And I think the role of technology, joining up all the data, has an important part to play in how we redefine pathways. And I just want to briefly show a video, if it works on the next slide, of how we're now able to sort of bring all this data together, just to give you a visualization. Is it working or not? No, it doesn't. We will move on. Keep going. It's okay. Next slide. Oh, it is. Okay. Do you want to press play and see if it works? I hope it does. Fingers crossed. If not, oh, it is. Slowly but surely. It's a little bit of a lag, but it's okay. But what you can see here is we're not just bringing the views of the intra-abdominal piece of the robotic surgery or the upper GI. We're actually being able to show you everything that's going on in the room. What's happening at the scrub table? What's happening with the team? What are the steps of the procedure? What are the instruments being used? How is the team working together? And that's just not only our technology, we're integrating other technologies that are existing in the market to bring this together. And I want you all to imagine when we talk about the Future of Surgery Commission, data, precision, analytics, these are just examples of solutions that are going to enable us to truly live up to that sort of vision and deliver on what the Commission wants us to do. I think it's also fair to say that COVID has massively accelerated what the Commission had stated from 5, 10, and 15 years to probably 1, 3, and 5 years, as we're seeing it all sort of come to life. And it's been fascinating and encouraging for me to be sort of part of that journey and to be one of the leaders of bringing innovation technology, not just through my own role as an entrepreneur, but also my leadership roles at my hospital, encouraging many other entrepreneurs to do the same. And we've been able to show we can do, looking at turnaround time, you'll see in this video, which you can't hear, we were able to do a month's worth of operating in a day simply by bringing technologies that empower our teams to work better, faster, and sort of more effectively. I'll end with a couple of slides, and I want to sort of hand back to the panel. Is I believe the core to all of this is people, it's patients. It almost doesn't matter what tech stack. We could sit hours talking about ChatGPT, AI, video performance, and bandwidth. It doesn't, I mean, that's great. That's the stuff in the background. What really is important is how we leverage these technologies to reimagine and redefine clinical pathways to give access to care. And I don't want to touch on all these stories, but they're all critically important to sort of why Proximie continues to exist. When we run our weekly town halls, we always start with a mission and vision story, which is about a patient and how solutions have changed the patient's life. But I want to just touch on the patient on the left, because this for me was probably one of those moments, you know, when you come home and you think, if I die tomorrow, I'll know I've sort of made, you know, I've made a difference in this world. And this story for me was that moment. This is a patient who unfortunately had developed during the height of COVID, metastatic testicular cancer. He'd had neoadjuvant chemo radiotherapy. He was quite unwell, and there was a huge concern about, you know, excising the metastases. They would normally have done it through a laparotomy, an open procedure. But the concern was around having him in hospital, so immunocompromised at the height. I mean, we're talking sort of March, April, around the height, in the early sort of days of COVID. And so it was clear we needed a very quick in and out procedure for this patient. And we have fantastic robotic surgeons. For anyone on the call who knows Guy's and St. Thomas's, it's one of the leading robotic centers in the country, amongst centers where Noha works and Newcastle and others as well. But we knew that this particular approach was quite complex, and it wasn't one that we did routinely. But we knew who the expert in the world was. And so my colleague, Archie Fernando, reached out to her mentor, who was in Seattle, and said, would you join me for this case? And through Proximie, he was able to virtually scrub in to the operation with her. They were able to work together, and they were able to excise the metastases robotically. And he was home sort of a day or two later. And he was on the news, on Sky News, speaking openly 7 days later and saying what a privilege it was for him to have access to this technology. And I think we need more patients to be championing adoption of technology, because I think sometimes we create barriers for ourselves that actually don't exist. Patients aren't afraid. They want innovation. They want us to be bringing the latest and greatest to them, as long as it's done safely, effectively, ethically, and with the right guardrails around information governance, IT, GDPR, and all of the above. And so when I think about, as we move to the next slide, the Royal College of Surgeons, I'm obviously a huge fan, and I think the RCS can play a huge role in accelerating the adoption of validated technology. I think that there's this sort of hope that the NHS Central is going to sort of approve all technologies that need to be approved. But I think, you know, with everything that's going on, there are challenges there too. But I think this is where the Royal College, and I know with the great work that Ryan and Dina and others are doing with the Innovation Hub, can play a role here. How do you identify, not hundreds, I mean, this is about sort of, it's really about the few technologies that have proven themselves in the NHS that need that acceleration of adoption for critical mass. And I know there's already work being done around this. And taking a position beyond advisory. How do you sort of advocate and actually push for adoption of those solutions? And again, I know that the Hub is starting to do work around this. I'm excited to see how that develops. And finally, I always wonder, is it time, is the commission up for an update? Is it time for us to sit around that table again? Maybe selfishly, because I just enjoyed doing it so much, to sit around and look around how we take a look at that commission now and think about, is it time for an update, given all the technology that's come to bear, even in the last few years. I'll end with just a personal perspective as well. I know that I'm fortunate that I have quite a unique portfolio career, but I don't take that lightly. I do spend quite a bit of time mentoring and trying to support others to hopefully secure similar roles. And I'm excited every time I get a call that they've been able to do so. So I would, if I've learned anything, I would say, think big and be bold. Don't let anyone put you in a box. Really think about, how you can push the boundaries. I remember as someone sort of, coming from overseas, a female sort of mother with kids, surgeon, I sort of hit all the sort of minority sort of check boxes, but I still was adamant that, I could do and make the change. And I hope that I can be a role model for others in the same way. It's about personal ambition and grit. And it doesn't have to be that this is the kind of career you have to have. You need to just decide what it is that you want to do and just keep at it. And think of it as a journey. There's going to be ups and downs. I cannot tell you how many moments I thought this is going to fail. That's it, I'm done. and you have to pick yourself up again and go. So, you know, just see those as moments of learning. And I've had many of those. But make sure that with that journey, you've got a great support network around you. And I'm very, very lucky to be surrounded by an incredible family that sort of champions me through that, and incredible friends like those on the panel today that have helped me. Always look for sort of different and diverse thinking. I always get asked about diversity. Of course, I would get asked that a lot on panels. What do you think about diversity? What do you think about women leaders? That's great, but I would also say that we need to really index on diversity of thinking. You know, we don't all have to think the same way. We don't all have to adopt the same approach. And I think embracing different thinking is really, really important. I sometimes, when I hire for my company, I tend to hire people that have never worked in healthcare. They don't have that bias. They come in with a completely different perspective, and it teaches me as well. And I think surrounding yourself by people that can complement you. We're never, like, no one is perfect at everything. And so I think having the insight to think about, what am I really good at? What can I lean into? And what are the bits I'm not really good at? And how do I make sure I surround myself with the best team, that I can get the best out of them and they can get the best out of me? Because you're paving new ground. You are disrupting. You're going to get pushback. It's going to be hard. There's going to be days that are really hard, and there's going to be days that are incredible when you're making those life-affirming changes for people. But above all, I think balance is important, and I'm definitely not good at that. So I would say balance continues to be a work in progress for me. But I love what I do. I'm incredibly privileged to have a portfolio career. And I'll finally just end with a really great quote I heard a few days ago, but it's not the strongest, it's not the most intelligent, it's those that are most adaptable to change that survive. And I think as we see this sort of fast evolving world of innovation, technology, and surgery, I think the more adaptable to change, the more willing to listen and hear and see what's possible, I think that the higher chance of success you have in this sort of ever-changing world of the future of surgery. So thank you so much. Thank you, Nuha, for the opportunity to speak here. I hope I didn't take too much time, and handing over to my friend Ryan, I guess.
Thank you so much. Nadine, thank you so much. I know you might not be able to stay for the end of the webinar. I'd like to just say two things. Number one, fantastic, well done, and you are an inspiration. Number two, everybody that you see on the panel today is an early years consultant. So yeah, we can do it. But as you said, collaboration, support, mentorship, all the keywords that you've mentioned before. I do need to highlight one thing. Although we all have our personal experiences with various platforms or devices, the Royal College do remain device agnostic, and Proximie is great, but there are other recording platforms out there that are in use. But the key thing is, regardless what platform one uses, it's about the data, it's about patient-centered care. One question for you, Nadine, before you disappear off, if that's okay. How has it affected your journey being part of the commissioning for Future of Surgery as a trainee, and now taking your ideas to fruition? How does it affect your current position as a trainer as well as innovator?
On a number of levels, and I would just echo what you said. I mean, for me, you know, as I went through these slides, I wanted to make sure that this was not a plug for the company, but really just to show the innovator's journey, and also how the Future of Surgery played a role in helping me define in my journey what were some of the key areas to focus on. So I would encourage everyone on the call to really go back and read that. I mean, there's just incredible sort of gems in there. And there's a lot of great platforms out there trying to make a difference. Regardless, I think ultimately it's about making sure that whichever one is being used, that it's generating sort of patient benefit, workforce benefit at the end of it. For me, I think what was really eye-opening was, first of all, I felt when I joined the commission that I found my people, that I found a group of individuals that were committed to really thinking about, you know, open-mindedness, like what is the future of surgery going to look like? Because it is not going to be the same as it was, you know, back in 2017 when we started writing it, and we're seeing that already. So just a willingness and an openness to really, with humility, look at what is the future going to look like, and what are the opportunities, what are the risks, what are things to be watchful for, but what are the things that we really need to embrace and sort of champion as we move forward. The second, I think it gave me a platform to speak about, as I was able to then go speak to chief execs of hospitals or chiefs of surgery, as a member of the commission, gave me that credibility to come and say, look, I am looking across the whole sort of spectrum of surgery. This is commissioned by the college. It's got a badge of honor. I mean, there's some credibility there in having those discussions. And the final bit, I think it was so thorough. I do sort of remember, I mean, it was hours and hours and hours of interview. And the thing that resonated to me the most with that was, and I think that's a credit to Richard and the leadership team around it, was every single interview that we did for that commission was recorded and was put on YouTube. So everyone could see transparently what we were asked, what we were being asked, and how we were thinking about it. As I think about that, it really gave me the courage as well to, I guess, speak above my pay grade. And I was an ST 4 or 5, maybe 6 at the time, and yet I felt more confident going in and speaking to chiefs of surgery, speaking to the chief exec of a hospital. And I think it is that comfort of speaking to that level of seniority that encouraged me to just go to the chief exec and say, I want a role that's, 50-50. I would like a role that is part innovation and part clinical. And, you don't lose anything by asking. Worst cases, they say no. But I think those learnings and those opportunities with the commission gave me that courage to go ahead and do it. I'm here to support and mentor anyone who's interested or needs to, happy to share my job description, whatever I can do to be helpful, always there to help.
So Nadine, I think the mentorship team at the Royal College will have your name now. We'll be in touch for sure. Thank you so much. And I'd like to pass on the baton to Ryan to tell us all about the Innovation Hub. Thanks. Thank you. Thanks once again. Thanks, Nadine.
Thanks.
Ryan, the floor is yours. Thank you.
Amazing. Can you hear me? Wonderful. Good. Nadine's gone. It's always both a pleasure and slightly terrifying sharing a stage with Nadine, as she's amazing, and she and I go a long way back, but it's great to know that she does have a flaw. Now that I know she's an Arsenal fan, will be perfect. Good. Okay, so next slide, please. So my name is Ryan Kerstin. I am, like Nadine, I'm a plastic surgeon. I'm the skin cancer lead for my trust and also the associate medical director for research and innovation. In that similar way to Nadine, I've managed to carve a role that's both clinical and the innovation work. And then in all my spare time, I'm also the editor for Bulletin and lead the team for the Future Surgery Innovation Hub. I am a senior tutor in Oxford for health innovation. I do some work for Proximie, some consulting, and ASAP Healthcare. So my journey started at med school. So back in 2004, I saw a problem. And wanted to come up with a solution, or came up with a solution and took that idea forward. And that solution was a product called TawnyStrip and a company called ASAP Healthcare. Now, at the time, innovation, a bit like Nadine alluded to, innovation was a dirty word. You didn't speak about it because actually, if you want to be a surgeon, you did research, you did audit, you did teaching, and anything outside of that was not to be discussed. And so, if we go to the next slide, with that, I'll come back to why the Future Surgery report, in my mind, completely changed the whole situation. So, I'm going to talk about the Innovation Hub. I'm going to talk about a little bit about the background. And I've started to allude to it, and Nadine had also kind of mentioned some of the things we're up to, but I will talk about kind of what the idea is, what we've achieved so far, and where we're going. Next slide, please. And again. The next one again. And this slide is absolutely key because a bit like, I'm sure Nadine would agree, that you can't do this on your own in any stretch of imagination. And actually, the reason that we've managed to do some really exciting things in terms of the Future of Surgery Innovation Hub is because we have an amazing team, all kind of made up of a mixture of senior trainees, new consultants. Marcus is a nurse from the military that set up the military's National Medical Innovation Hub. We also have 2 foundation doctors and massively supported by Ralph as well to help us go forward. So I don't want you to see any of the next slides and go, well, that's what Ryan's achieved. That's not, it is a team game, and whatever you want to do in innovation, and the reality is in anything else, you need a team behind you. Next slide, please. And again, so I mentioned that the future of surgery changed everything. So at the time, I was the technology editor for the college, and I was asked by the publishing team if I would read the report and give a kind of synopsis and review of it. Unfortunately, I wasn't a member of the commission. And I'm not a report reader. As a kind of self-diagnosed dyslexic, the idea of reading a 40-page report was never something that would have appealed to me. And I sat down and I read it start to finish and was buoyed by it. I think it is a fantastic report, and I commend anybody that hasn't read it to read it, because on the background of people being told innovation was not something that you discussed and you did, and you take it off your CV, suddenly there was a publication that said that surgical teams can be expected to spearhead the transformation of surgery with new technologies. Hang on, this isn't the usual thing, and that we need to be prepared and ready for the future, and we should be nurturing innovation. I couldn't find the quote for this, but in it is my favorite quote of all from the whole report, and it talks about the surgeons of the future being the conductors of this kind of broad orchestra. So yes, our core skill is the ability to operate, but actually there's a step, there's an armory behind that of being able to kind of work with data scientists or 3D printers or software engineers, and we're depending on our patient in front of us or the cohort of patients we look after. We should have, as surgeons, the understanding and the language to go and talk to people outside of surgery to ensure we're delivering the best care possible. Next slide, please. So the report talks about that we need to equip the surgical team of the future in innovative care. Well, how do you do that? Because we're only meant to do research and audit and teaching. So what is there to equip us? Next slide. And this I really like, and I'm a huge believer in it. Anyone that's heard me talk will hear me talk about my favorite hashtag ABCD. As we're medics, most people think airway, breathing, circulation, disability. Actually, it's not. It's always be connecting dots. So that ability for us to go, we have a problem with X, how does industry deal with it? Or can we go out to industry partners to work together to come up with a solution? And it was there in the report, this ability that we need to be working with industry and linking those gaps up. Next slide, please. And we need to achieve all of these kind of pretty lofty aims through a mixture of networking events, kind of meet your tribe, go and find the other surgical innovators up and down the country, but also go and meet the innovators in industry and put everyone in a room together in order to start cracking these problems, and especially to having that diversity of opinion that Nadine was talking about. Next slide, please. So, amazing report. And I had this history and love of surgical innovation that I couldn't talk about, but now suddenly there was. So I wanted to be part of that movement that where we were moving towards innovation. And so I approached Neil Mortensen and Tim Goodacre to say, I've got this idea and I want to build on the amazing work of the report. I want to have a place that people can go to, they can get mentorship from innovators like Nadine who have been there, and want to be able to provide them with intra and entrepreneurial resources, because we've all been to med school, most of us haven't been to business school in addition. And so actually, what is a non-disclosure agreement, or how do you write a business plan? How do you put all these things together? And also having the ability to formally recognize the surgical innovator role. And I take my hat off to the college that actually we are ahead of pretty much every other college in that recognition of the surgical innovator role. The fact that we have a webinar series specifically around surgical innovation, the fact that we have our hub space that we're kind of growing. So I think we are getting there. There's lots of work still to do, but it is, yeah, recognition of this surgical innovator is like the surgical site, the academic and the surgical teacher. And then finally, I wanted to create a network that we could join up all the dots. Next, please. In this next piece, you get to get some break from me wittering on. So what have we managed to achieve so far? Well, for those of you that read Bulletin, which is obviously everybody on the call, we had a whole issue that we took over early last year, where we took surgical innovators and got them to tell their story for each part of the surgical journey, from how do you find a problem, how do you start to ideate, how do you prototype, and it's freely available online, so you can go onto the Bulletin archives and you get all the previous Bulletin issues for anyone that happened to miss an odd article here or there, and you can see our tech takeover. And we've also got our regular technologist, which I handed on to Tom Dobbs, another plastic surgeon, in order to keep that flame going. So there's always technology. We're always trying to show our colleagues what is out there, both what's good and what's not so good. Next, please. In addition to the Bulletin, at the end of last year, we ran our first industry workshop, and we had over 25 major companies. And when I say major companies, Google were represented, Microsoft were there, Medtronic, J&J, NHS England, the NHRA, AHSNs, a number of startups. So we really did go out to industry, and they are really keen to work with us. And I don't mean that in a cynical way. It's not that they see the kind of the floodgates of customers, but they genuinely want to help. And to date, there hasn't been that place that they could go to in order to provide their expertise to direct to surgical care. Next, please. We also hosted an event at the Future of Surgery show last year, and watch the space for the 2023 Future of Surgery show. Both a plug for the show in general. It is a great conference. Like, it is nothing like the usual healthcare conferences. These are really interesting dynamic sessions, but watch out for the Innovation Hub sessions. More to come, but Jane will probably tell me off if I say anything else. Next slide, please. We supported ASIT and the Expert Advisory Network at the end of last year in hosting the first Innovation Skills Training two-day event or two-day workshop at the college, and hopefully we'll have another one later on this year. And again, a mixture of getting surgical innovators in, but also industry experts to talk about innovation, to help empower people to take their ideas forward. Next slide, please. I am conscious of time, so I will slightly rattle through. I think I've kind of made my point about Bulletin. Next, please. We also put out a survey to members who have said, even the ones that to date haven't had any experience of innovation, said that they were interested in learning about it more and interested in having a space where they could mix with people. So obviously it's not just mine and the rest of the team's kind of slightly biased view, that actually even those that haven't managed to join that innovation conveyor belt yet are really keen, and we want to provide that platform. Next slide, please. Yes, yeah, next one. Yeah. In addition to the back one. In addition to the industry workshop that we ran, we also ran a members workshop where we did a 5-day design sprint in half a day. Again, to look at how do we make sure the surgical innovator role is a recognized role. Well, what was the task of one group? And the task of the other group is actually how do we ensure that good innovation is disseminated, because as we know, surgery and healthcare in general is hugely siloed. So what are the steps that we need to make sure as an innovation hub that we do in order to make sure that good innovation, good technology, good practice is shared across the surgical ecosystem? Next slide, please. And finally, that hopefully we have a kind of provisional innovation hub space, which is going to be part of the Future of Surgery space within the college. And so this is open to members and fellows, that if you have innovation activity that you want to carry out or meetings, we have space that we can provide within the college in order to for you to have that. And again, all part of that recognition that innovation is part of the surgical setup. Next slide, please. We're also working with a number of industry partners in order to bring in some expertise from external. Next slide, please. And again, watch this space for some good announcements. We have early agreement with the legal team who are a resident within the college building, who are happy to support surgical innovators with some early stage advice. So again, come through to myself or any of the other hub members and we can put you in contact. Next slide, please. We're also representing at various other events to make sure we get the word out, but also that we're aware of what else is going on, because we don't want to reinvent the wheel. We want to work with other people for the benefit of surgery. Next slide, please. Next slide. I've kind of touched on that. Okay, so that's what we've done so far, but what's coming up in the future? Next slide, please. I'm aware that I've got 3 minutes. So hopefully in the not too distant future, we will publish our full report. So if in my speed rambling you missed anything, you can read the report, which again, is going to be excellent. We have 2 in-person events. I'm going to come back to the one next week shortly on the next slide, but we've also got one on the 11th of September, which is going to be on how you take a QI idea to startup. So watch this space if that's of interest. We've got a number of online meetings and webinars planned. We're just waiting for dates, and again, we will disseminate that out. And I've already mentioned the Future of Surgery show. Next slide, please. So what are we doing next week? Actually, Nadine perfectly encapsulated this. Next week, we have a load of surgical innovators that have portfolio careers to come and talk about how they got their careers, what they've learned, and how the 2 areas benefit one another. So we've got surgeons that are venture capitalists, surgeons that are entrepreneurs, surgeons that are management consultants, and academia and medical education, all coming for 20 minutes where they will explain their journey and discuss backwards and forwards. It's free to join. The QR code is on the screen now. Please do come and join. It should be absolutely fantastic. The faculty are really inspiring. Next slide, please. We're also, this is the kind of small print of the other stuff we're getting up to, that we're trying to build out the resources and templates for surgical innovators. A bit like Nadine said, we're going to create a template for the surgical innovator job plan that you could use when looking at new jobs, looking at ways of working with industry to get people industry experience in innovation, but rooted within surgery. And just making sure that innovation is part of that broader discussion. Next slide, please. So next slide, what do we need from you guys? This is not a one-way street. We want as many people involved as possible. We want your comments, positive or negative, in terms of what you think, in terms of what we're doing. If you want to get involved, again, get in contact. If you want to come to the events, please do. They are completely open to everyone. You don't need to have had innovation experience previously. We just want to infuse you for the future. Next slide, please. And that's it, with 36 seconds left.
Fantastic. You can catch your breath now. Ryan, thank you ever so much for a fantastic presentation, an overview of what the Innovation Hub team have been doing and what they've got planned for the future, and a few little plugs for Future of Surgery. Thank you for that, as well as other events coming up. We've got Jane on the screen, and I think because of the slightly later start to your talk, we'll allow a couple of questions from the audience. But in the meantime, if we can just put the slide up of what's coming up next, what's to look out for from a webinar series point of view, and from the events point of view. If it's not there, we can talk through it.
I can talk through it, sorry. Having a lot of slide issues tonight. My apologies for everybody watching.
The Innovation Hub will sort this out.
We will. There's always something a little bit nerve-wracking about doing anything that's futuristic, because it is almost like an absolute nail in a coffin to any technology. So my apologies. We will circulate all of the dates that Ryan mentioned and the dates for the next 2 webinars. So we have got 2 webinars planned for the autumn, sort of September and October, and we will put those details in the email that we send around tomorrow with a link to the recording, where I will carefully edit out the issue with the slides so nobody will ever know that it was there. But the main and big event for the events team is the Future Surgery show, so please do watch out. But also you can sign up to a mailing for all our events, and we will share all of those with you. And I have got a few questions if you are happy to dive in.
Pick the most difficult one for Ryan.
I could also, there was one for Nadine. I can ask him that one, but I will try for something.
Do you mind if I've got a question to ask first, and I get chair privileges?
Sure.
So a question, it was both to you and Nadine actually, Ryan, and you know, innovation and gathering data, recording data, and the importance of that. The UK are a little bit behind, so we know that the Dutch have got the black box in theatre and they've been recording for quite some time, so have the Canadians. How do you think, and again, you and Nadine touched upon it, how do you think innovation can take us forwards with regards to patient care? You've mentioned supporting trainees who are interested in innovation. You mentioned supporting consultant surgeons with regards to their job plans, but how do we bring this back to the patient focus?
Yeah, so I think personally, I think that any innovation has to be grounded in what's the problem. If we kind of put it into our kind of surgical care, and that can be anything from morale, which is obviously super topical at the moment, to the way we communicate with patients, to the kind of specific technology in theatre. So when you start that kind of innovation journey, you'll think, well, what's the problem I want to solve? And if you have a really clear problem, then hopefully whatever it is that you develop will answer that problem. And ultimately, we're all there for the patients. There is a, when you think about innovation in healthcare, it has to add value. So in answering that problem has to add value. And that value is either directly improving patient care, very difficult to actually prove that you've done, or reduce the cost to get there. And that could be anything. Again, it could be improving morale. If you improve morale, you increase retention. If you increase retention, you reduce the amount of cost and onboarding and so on and so forth. So you've got to think that, so what's the problem? What's the value that I'm creating in solving that problem? And if you answer that, you will 100% kind of deliver value for our patients.
Brilliant, thank you, Ryan. And my own 2 plugs here are the Future of Surgery webinar series. Next one is on training, and the one following that will have patient representation. Over to you, Jane.
Thank you. So questions, not the one for Nadine. Where does research and innovation sit within the college and the Future Surgery report? Leave that one for you to pick who wants to answer that.
There is your 2.
Absolutely. So I think research is at the heart of everything that we do. Without gathering data, we don't know whether what we're doing is actually, number one, right, number 2, working. So we touched upon research previously when in the quick intro that I gave earlier. The current projects that are ongoing for robotics, for example, are the Mastery and Reinforce as part of the college, and we've had publications already, and we've got a combined HEE and Royal College of Surgeons of England research fellow who is doing qualitative work under supervision of Simon Bach, looking at, again, training in robotics. So these are just tiny little examples of how we plan to look at the other aspects of big data, collaborating with industry, and of course innovation, massive area for developmental research. I'll let you answer that part, Ryan.
Yeah, it is a really common thing, and even my trust job title is research and innovation. So the 2 are often put together. I think they're not particularly comfortable bedfellows. I think that whatever you do from an innovation point of view, you have to always have metrics that you're measuring against to make sure you're doing what you think you're doing. But the the mindset is slightly different, but the two complement each other, which is why within the college that actually the Innovation Hub sits within the kind of research and quality group, because actually, we should all be collaborating and sharing knowledge across the areas. And there will be times when an innovation project will need to spring into research, and we need to ensure that we've got the expertise from our research surgeons. And there will be times when, from a research point of view, they're straining back into the innovation side, and we need to work collaboratively. I realize it's a bit of a kind of politician's answer, but it is difficult, and they are often lumped, and they're not quite the same.
Yeah, no, absolutely agree there. And Future of Surgery is under the quality and research umbrella as well of the Royal College, specifically for that reason. They go hand in hand, but they're not mutually exclusive. I think we have to thank our audience for staying behind a few minutes. I know we'll have lots of questions, but I think what we'll do, if it's okay with everyone, is jot them down, and they'll be answered at our next webinar series, because this is just the beginning. I'd like to thank you all on this warm evening for being with us today. I'd like to thank Ryan and Nadine for their fantastic presentations, and Jane and Antonia in the background for dealing with the tech and facilitating this webinar. Thank you all for being here today, and we'll see you at the next one.
Thank you.
Bye-bye.
Cool.